This is my student support system. Keep watching, keep learning. What are the complications that the patient should avoid or should prevent? The complications are basically of two types: acute complications and chronic complications. In acute complication, the major three acute complications are there: hypoglycemia, DKA, that is diabetic ketoacidosis, and HHNS, hyperglycemic hyperosmolar non-ketotic syndrome. First, we will see the what is hypoglycemia. Hypoglycemia is a condition in which blood glucose level falls less than 50 to 60 milligram per 100 ml. Now you can think of that in diabetes or normally blood glucose level is high. How hypoglycemia develops? This is because taking more insulin than required, then glucose level may go down, or taking more hypoglycemic agent accidentally or by mistake, or after taking insulin there may be missed breakfast or missed food, then hypoglycemia may occur, and excessive exercise may also lead to hypoglycemia. Clinical manifestations of mild hypoglycemia include sweating, tremor, tachycardia, palpitation, nervousness, and hunger. Clinical manifestations of moderate hypoglycemia include inability to concentrate, headache, lightheadedness, confusion, memory loss, numbness of the lips and tongues, slurred speech, impaired coordination, emotional changes, irrational or combative behavior, means behavior change, double vision, and drowsiness. Clinical manifestations of severe hypoglycemia include distorted behavior, disoriented behavior, seizures, difficulty from arousing from the sleep, or loss of consciousness. How we will manage hypoglycemia? Management of hypoglycemia includes immediate oral administration of 15 gram of fast-acting concentrated source of carbohydrate such as glucose tablets or candies or juices. In emergency situation, for the clients who are unconsciousness and cannot swallow, then an injection of glucagon 1 milligram can be administered either subcutaneously or intramuscularly. Hypoglycemia is prevented by a constant pattern of eating, administering insulin, and exercising. It is important that patients with diabetes, especially those who are receiving insulin, learn to carry some form of simple sugar with them at all times, so they can use it in emergency. Next complication is DKA, diabetic ketoacidosis. Diabetic ketoacidosis is caused by chronic inadequate or missed dose of insulin, chronic illness or infection, and or an undiagnosed or untreated diabetes. There are three main clinical features of DKA, that are hyperglycemia, dehydration and electrolyte loss, and acidosis. Management of DKA include correcting dehydration, electrolyte loss should be corrected, and acidosis should be corrected. In addition to correcting the blood glucose level, IV fluids are prescribed to correct dehydration. Ketone bodies accumulate as a result of fat breakdown, so this acidosis that occur due to DKA is reversed with insulin infusion normally used. Next complication is HHNS, hyperglycemic hyperosmolar non-ketotic syndrome. HHNS is a serious condition in which hyperosmolarity and hyperglycemia predominates, with alteration of sensorium and without ketoacidosis. Persistent hyperglycemia causes osmotic diuresis, which results in loss of water and electrolytes. The clinical manifestations of HHNS include hypotension, Signs of profound dehydration such as dry mucous membrane, poor skin turgor, tachycardia, and variable neurological signs such as alteration in the sensorium, seizures, hemiparesis, etc. In the management of HHNS, it is similar to that we have just discussed in DKA, such as fluid replacement, correction of electrolyte imbalance, and insulin administration. Now we come to chronic complications of diabetes mellitus. There are three major categories of long-term diabetes complications, that is macrovascular complications, microvascular complications, and diabetic neuropathies. Macrovascular complication. Macrovascular means medium to large blood vessels. The complication of these vessels, complication occur due to wall thickness of the blood vessels, and these walls may contain plaque, and that is adhered to the wall, and the blood flow is obstructed. Especially coronary artery disease, cerebrovascular disease, and peripheral vascular disease. These are three main macrovascular complications that occur frequently in the patients with diabetes mellitus when they have long-term problem. Microvascular complication. Diabetic microvascular complications occur in the capillaries. There means very small blood vessels. There is thickening of the basement membrane of capillaries. Eye problem, that is known as diabetic retinopathy, is caused by changes in the capillaries of retina. Diabetic nephropathy or renal disease secondary to diabetic microvascular complications or changes in the kidney is common microvascular complication of diabetes mellitus. Next is diabetic neuropathy. Diabetic neuropathy refers to a group of diseases that affect all types of nerves, maybe sensory, maybe motor, and others. The two most common type of diabetes neuropathy are sensoromotor polyneuropathy and autonomic neuropathy. Decreased sensations of the pain and temperature place the patient at risk for injury and undetected foot infections, that is also known as diabetic foot ulcer, because client is not able to sense the pain of foot infection or small cuts and wounds, and that become a large ulcer. So now we will discuss the foot and leg problems in diabetes mellitus, because they are most prominent in these clients, especially if the patient is of older age. Even in community we can see these patients. Between 50 to 75% of lower extremity amputations are performed on the people who are suffering from diabetes. It is also included in the long-term complication of diabetes mellitus. The typical sequence of events in the development of diabetic foot ulcer begin with the soft tissue injury of the foot, then formation of fissures between the toes and an area of dry skin and formation of callus. Patients with insensitive foot due to neuropathies do not feel pain at the injury site, which may occur by using heating pads. The client is using heating pad in the winter and cannot sense the temperature, then the skin may burn. Walking barefoot on the hot road or hot concrete, testing bath water with foot, and traumatic such as injuring the skin while cutting nails, walking with an undetected foreign object in the shoes, or wearing ill-fitting shoes and socks. My student support system. Keep watching, keep learning.